The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well with us. Dr. Chapman, it's great seeing you. Thanks for coming back.
Good to see you, Shay. Thank you for having me.
So, yeah, sure. The last time you were here, we talked about hormone imbalance. Today, we're going to talk about what you can do there at Living Well to treat that.
Yeah, so, again, last week we talked about the signs and symptoms of hormonal imbalance. And then one thing we didn't mention last week is if, patients want to go out to the website, we have a nice symptom tracker that you can fill out there and submit if you're interested in possibly having a consult. But that's where it starts. It starts with a consult. Patients come in, we sit down, we go over their history, we talk to them about their signs and symptoms, what has been done in the past to help treat these signs and symptoms, and then blood work is ordered to evaluate a myriad of things, their testosterone, their estrogen, their thyroid, their vitamin D, B12, their kidney function, their liver function. All of this is looked at. And then based on that, a plan is formulated as how we can, if they are candidates, replace their hormones or balance their hormones. A lot of these signs and symptoms are relieved by hormone optimization. And that means the hormones to a level where they have relief of the symptoms with few or no side effects. And that's where it comes in that the patient and I communicate. We must communicate and talk about how they're feeling and are they having a relief of their symptoms as we treat them. We use pellets here at Living Well mainly as our source of hormone replacement and optimization. It's an implantable, 100% pure bioidentical hormone that is usually made from a plant source. It looks identical and acts identical to the hormones that are made in our bodies. It is implanted in the sub-Q or the fat tissue. Here in the fat tissue, there's lots of little tiny blood vessels that go to the fat, and that is where the hormone is picked up and it is recirculated through the system. It avoids first pass through the liver, so we don't have the breakdown of the hormone, and you get the natural use of the hormone in the body as if it were being released. Transdermal or subcutaneous is two of the best ways to deliver hormone therapy. Injections, as many people do, that is not optimal. It stimulates a lot of things that we would rather avoid. On oral is really actually never really should be an option, especially with testosterone. So once we've implanted, then we, evaluate the patient in about 4 to 6 weeks, and we see how they are improving with their signs and symptoms based on the dose that was given, that was calculated, that was based on their levels in their blood. I will say 93 to 95% of our patients are coming in with big smiles on their face, really saying how much their life has improved by participating in this program. Occasionally, you'll have someone that it takes a little longer to get them. And there are a few at times that this really doesn't do anything for. And so, it's those evaluations that you have to have and those conversations that you have to have. And like I say, it's not for everyone, but it certainly helps a lot of people. And we've seen great success with it. And, those symptoms of fatigue, foggy thinking, low sex drive, poor recovery in the gym, joint pain. So many things can be related to your hormones, and optimizing those levels can really help relieve those signs and symptoms. And so, if patients out there are suffering with these symptoms, and of course they can go out and look up more symptoms on the symptom tracker, and want to reach out to us for a consult, they certainly can, or to talk to their current primary care providers about what's going on with them, and just have that discussion. But we do recommend considering this an option in your care because it is important, and it will help to increase the quality of your life. And there's so many studies being done now that are showing such great improvements when hormones are optimized in the body. It definitely is at the forefront of what is happening in anti-aging or healthy aging medicine, as I like to call it.
Oh, it certainly sounds like something I'm sure a lot of our viewers could benefit from. So we appreciate you coming on and sharing the information with us.
Thank you for having me, Shay.